you, Megan, for staying to discuss more sensitive aspects of hemophilia, deeply painful aspects of hemophilia. You spoke on the program about having your grandmother losing 9 sons. Can you tell us more about it? Was it at birth? Was it just after birth? Was it in the first year of life? Can you share with us what happened?
Thank you, Dr. Pamela. Like you said, it's a very emotional side of hemophilia. And that's what I tell people. The pain and we see is just the tip of the iceberg. It's actually more of the emotional trauma that we are dealing with as parents and even as patients. My grandmother is the surviving daughters. Only her and her sister. Her own mother had lost 4 sons. Now, 3 died post-circumcision bleeding. Her 4th son, they didn't circumcise because she had lost 3 sons. But at the age of 6, which when I started hemophilia and I knew was an intracranial bleed, he must have fallen. He must have hit his head somewhere, but nobody knows. The only thing my grandmother said they noticed from her brother was he was just shouting, headache, headache, headache. And that was how it continued. And in those olden days, they just labeled it that witches were calling him.
Yes.
It was a spiritual attack. So they lived as 2 sisters. Then she started having children, and she had her first child was a male. Circumcision, he bled and died on the 3rd day. Her second child was a female. Then she had 3 sons consecutively, and all of them died post-circumcision bleed. And that made it 4. Then she had my mom, who was a female too. Then she had a set of twins after my mom. Were both males. They left circumcision for them. They thought maybe because they were doing it at 8 days, they were still babies. Their body had not developed well. So they told her to wait until the twins were like a month. They did circumcision, and one of the twins didn't make it till the next morning. The other one died after 4 days of bleeding. So that made it 6 sons.
Wow.
So she had my mother's younger sister, then she had another son. Now, on this one, someone advised her, that was even the most painful for my grandmom of all the deaths. She was advised to go to a traditional healer, and she worked in the farm of that traditional healer for 9 months. Because they said because he was a male child, she needs to leave him until he's 9 months. And she was working for the traditional healer in his farm. And the day the child clocked 9 months, they decided to do the circumcision. Excuse me. And he didn't make it until the next morning. So at that point, she just believed that she was tabooed to having male children. That was the long and short of it.
This must be so excruciatingly. And apart from losing the sons, you can imagine how the brothers will be reacting to her. Because that's what happens. They blame the woman, and they stigmatize on the woman, and they call her a witch. They call her all sorts of things. What things did she go through?
And you won't believe it, Dr. Pamela, that this is 2025. And I have mothers that are still going through that. I have mothers who have been driven out of their husband's house just because they have sons with hemophilia. I have mothers who have been called witches and their husband has abandoned them with children just because the boys have hemophilia. So it's still happening, even in 2025. That abandonment is still happening.
That is terrible. Because apart from the pain, the anguish of losing children, and also, why are we so obsessed with this circumcision? Why must we circumcise? This is what I don't understand, is that, the child is having a problem with circumcision. Why must it be done? It's like a must.
And we even tried, you won't believe it, that we try to even advise. We know it's a cultural belief in this part of the world. And we tell parents, if you have lost a child to hemophilia, don't circumcise the next male. Let us prepare. We can actually prepare for the circumcision. We actually just did 6 circumcision in Gombe, in Yobe, about a month ago. We prepare for them. We plan for the factors that they will use. But you will see parents, if they call you and say, we want to circumcise, and you tell them to hold on, they will decide to go and do it without factors, knowing this child will bleed. Then they will come for you with an emergency that shouldn't have happened at all. So that mentality, that's what we need to call it. I always joke, but I'm being frank with people. I tell them, the boy does not need to use that thing now. Why are you in a hurry that you must cut it now? Wait until we can plan for this child. Why put the child's life at risk
In danger.
for something that could be avoided, something we could plan for, and everybody will do it at peace of mind? But some parents are so adamant, and they will tell you it's our family culture that it must be done at 8 days. And then they will put the child in a huge problem, and everybody in distress. But do you know that circumcision is even little? We have in the northern part of the country where there's a culture of cutting the uvula when the child is just 2-3 days old.
No.
A child with hemophilia will come gulping blood.
Oh my goodness.
I have 2 boys, and that was how we met them. And we've been trying to correct that culture. They don't want to stop it. They do it 2-3 days into life.
I wonder why. It's just the culture.
It's just a culture. So there's so many things that are attributing to this pain. And then you now think of it, if you are able to weather the storm through the early stages of the child's life, and he starts going to school, and he has these frequent bleeds, he has a target joint. Some of these boys by the age of 7 are already on crutches, are already using a walking aid to walk. And then they call them names at school, which is something that we're also trying to correct, which is educate the school. And it still goes back to the parents, because I try to educate parents that you are your child's first advocate. If your child even if your child has started, is in a school where he started from kindergarten, we know that every year a child gets a new teacher. At the beginning of the year, take time to go and educate the teacher, educate his classmates. This thing is not contagious. This is how you can help the child. If the school has a school nurse or a dispensary, take a vial of factors and let them have it in school. That puts the school's mind at ease, that even if there's an emergency, they know what
know how
to
to
do.
handle it.
And how to handle it. But when you don't do that, and you just go and tell them, my son has hemophilia, he must not get injured, he must not have a cut. Schools now isolate these children. The children feel they don't allow them to play with other children, because the school is scared of him getting an injury, because you've not educated them that the child still needs to live his life as a child. I tell them, if you take away their childhood, it's going to affect them when they become adults.
Wow. I mean, this is so difficult. And I actually have family that I know that have lost a couple of sons. I think 2 or 3 sons as babies. And of course, we don't know why. You know how it is, because
Why?
nobody talks about it. A lot of these things, people sort of shroud it in mystery, and they don't talk about it. But in fact, it's something that used to be called the royal disease, if I remember. The royal families in Europe, a lot of their sons had hemophilia.
Yes. The Queen Victoria had a son, Prince Charles the First, not the present king, had hemophilia. And then 3 of her daughters who were carriers, married into the royal families of Russia, Spain, and the Netherlands. And so they had princes. And the most prominent was the one we call Alexia, the prince with hemophilia, the prince from Russia, who had hemophilia and decided to go into war and got shot and bled to death. So that's why it was now named the royal disease. And the royal family actually have factor 9 deficient, well, as Prof was explaining, it was hemophilia B. They were factor 9 deficient. So, and because it's more rarer than factor 8, very few people have factor 9. You tend not to see a lot of factor 9. Like for us, we have 887 patients. Our factor 9 patients are not even up to 50. Majority are factor 8. Then we have females with von Willebrand's disease, and we have females who are carriers. Prof was talking about if a woman must have a lionization or be have a father with hemophilia and a mother who is a carrier to have hemophilia. Sometimes it doesn't happen that way. And what we've been agitating for, even at the global level in the bleeding disorders community, is if 40% is the benchmark, and I, as a mother of 2 sons with hemophilia, have 28%, that classifies me as a person with mild hemophilia. I shouldn't just be classified as a carrier. I have mild hemophilia. And so doctors should listen. I have the tendency to bleed. I had to have a xerectomy in 2013 because of menorrhagia. And nobody was listening that I needed to use factors. So we need to look beyond just calling mothers carriers. We need to check factor activities of mothers and sisters of these boys. If 40% is the benchmark, if a woman has less than 40%, we need to look at her symptoms too.
Definitely, definitely. I think there's a lot more to hemophilia than meets the eye.
Yeah.
And I'm so happy we're having this one-to-one now, talking in more depth about the issues. But can I ask though, how do you find mothers, are they receptive to the diagnosis? Do they go into denial?
You would not believe the strong Megan you are looking at today. When I had my second son, despite that I've already had a son with hemophilia, and I had my second son, my first son was born in 1996. I had my second son in 2008. I was still in denial for like 6 months. I was seeing the symptoms and I was telling myself, no, this one cannot have hemophilia. Just because I was not ready to go through that same pain. Just because I was not ready to go through that trauma. Dr. Pamela, I have laid my son on the bed and prayed for him to die, my first son. Because he had a cut here and bled for 21 days.
Oh my goodness.
And I felt death was better. So I wasn't ready to go through that trauma anymore. My husband has carried my son, put him behind the car, and drove out for 3 hours, believing the boy will give up. Because we have dealt with bleedings. Our hospital get to a point, they tell you there's nothing they can do again. So I have seen it. So living in denial, if I see mothers who are doing that, I put myself in their shoes. And I allow them to go through that phase. And sometimes I do the same thing my nurse did for me with my second son. When my son had a cut on his lips and was bleeding, and he was bleeding for 3 days, my nurse came to my house and was like, Auntie, he doesn't have hemophilia, but let's just give him the factor. And she said, he doesn't have, but let's just give him factor. And she gave him, and in less than 30 minutes, the bleeding stopped. And then that was actually when it dawned on me that I have actually made this boy to suffer for 9 months without not accepting the diagnosis. But it happens. When you think, especially if you have had a child before, when you think about the pain, the trauma you've gone through, the names people have called you, you don't want to believe another child should have it. You don't want to. So it's a phase that mothers go through. But if eventually they get a grip of it, they actually, they run with it because it's a lifelong condition.
Yeah.
You are born with hemophilia, you live with it.
Yes.
The place where I am having a challenge currently, and I'm actually having a meeting with them next week, Saturday, is the older patients.
Okay.
Patients who have crossed 30 years and above. now thinking they don't need the foundation anymore. Now draining themselves in painkillers and then coming down with bleeding into their kidneys.
Oh my goodness.
So that is a trend that we are beginning to see. In the last 2 years, we've lost 4 adults between the ages of 37 and 45. Oh,
my goodness.
All of them coming
all the way there,
coming down with bleeding into the kidney. So we just organized a meeting next week, Saturday. I just wanted to talk to them. What is the problem? Why are you now wanting to say you don't have this thing anymore? Nobody told you you're going to outgrow it. So why this issue? And all of them have daughters. And I keep telling them, if you're not doing anything, do it for your daughters. Because as a man with hemophilia, your daughter is an obligate carrier.
Yeah.
She carries the gene. She has that 50% of having a son. So do you want that girl to live with the fear that her son, after every suffering, will just fall and die one day, just because you have refused to use your medications and you are relying on painkillers? So there's a lot of more emotional trauma than even the pain. We are doing one mental survey among our patients, and we said patients from 12 years and above should answer the question. And a mother reached out and said, all the questions we asked in that place, her 9-year-old is already presented. Now, for a 9-year-old, last year, October, to take a wrapper and say he wants to commit suicide, he wants to kill himself. 9-year-old. So these children, isolating them, not allowing them to play, telling them they can't do this, is also causing a mental illness for them. So we have to look at the child. Most of the times what I tell parents is, see the child before seeing the hemophilia. If you are seeing the hemophilia before seeing the child, you would not allow this child to live his life. And when you deny a child, like the 9-year-old, when I spoke with the mother, the boy's concern is, everybody washes plates in the house. They don't allow me to wash. They will say I will cut myself. They don't allow me to do anything. And all my siblings, when mommy is not there, will not call me useless. The boy is feeling pain. He wants to be part of other children. So as we need to, it's an holistic management of hemophilia. I tell people it's not just about stopping the bleed. That's why our slogan in the foundation is giving persons with bleeding disorders a meaning to life. It's not just about stopping their bleed. They need to know that they can be useful to themselves, to the family, and to the society. That they are not a burden. That we're not just trying to just keep them alive. We should allow them to live.
I think there's just so much that you've shared, this on this special edition to let us understand really what hemophilia is about, and to let, I think, people who are listening also understand that if they have this challenge, I think the most important thing is to be part of the foundation that you're running, to not only share their own story, but also help others. Because if they've gone through it maybe successfully and they're managing, they need to be able to share how they did that with others who are not doing so well. And if they're not doing so well, then they need to come in and become part of those and listen to those who have managed and benefit from it, so that the children do not suffer as even more, because it is not an easy condition, but there are things and there are steps that can be taken to lighten that load for both the mother and for the children. So I just want to go back to the mother again, because even though March is past, we're in April, but the Women's Month has, for me, it's always Women's Month. And the pain that we're talking about, you talked about abandonment. What can be done? Are there any places that women can go to if they're abandoned? How do they cope?
One of the things I used to say as the first step to abandonment starts from the diagnosis. The way we present diagnosis to families as healthcare providers need to change. And that's why in developed countries, when you have this chronic condition, and your diagnosis comes out, they send you to go and see the social worker. She breaks the news to you because she knows how to break the news to you. When my son was diagnosed with hemophilia, I was sitting opposite the doctor, and he said, your son has hemophilia. It was the first time we were hearing that word. And we asked, what kind of condition is it? How did he get it? And the next answer was he took it from his mother.
Wow.
The typical African man will have a step back. He took it from his mother. Where did she bring it from?
Mm.
And I've always told him that we need to change that narrative, because if you say he took it from the mother might have taken it from her own father. So it's not right to just put the blame on the mother. As much as it is that when a son has hemophilia, it means he took the affected gene from his mother, the mother could as well taken that gene from the father. Or the child might be a mutation. It might not even be from the mother. The mutation Prof talked about might not even occur in the mother. Sometimes it occurs in the child. The child will be the index person. So we need to understand and not
stop playing the blame game, I think, is the key.
Exactly. Don't shift the blame to the woman. And then as a family, as a couple, extended families, mothers, grandmothers, aunties, we need to accept it. Not for a mother-in-law to start telling her son, go and marry another woman. This one, all our sons are not healthy. That was what one of my mothers was told. And the man just left. Woke up one morning and left her with 2 sons with hemophilia and a daughter. And then sent her a text message that he's not coming back.
Oh.
He has gone to marry a more healthy woman.
That's terrible. So those are all his children. He just abandoned his children.
He just abandoned them. This is almost 8 years. He just abandoned them. And he didn't even have the courage to speak to her. You just told her you are coming. And you left the house to send a text message.
Terrible.
That you are not coming back. So acceptance is the first thing. It's not the woman's fault. Nobody has a choice over which chromosome the child will pick. Nobody has choice. So the woman does not have, if she has a choice, she would not know that she has an affected X and give that affected X. Because as a mother, you know what it means. Having a child with hemophilia is sleepless nights. If there's a joint bleed, you can do 3 days that you will not close your eyes, icing that joint. No mother wants to suffer that. If your child begins to change from milk teeth to their permanent teeth, every tooth that falls off is days of bleeding. You wake up and the pillows is soaked. You can do that for 5-6 days as a mother. No mother wants to go through that if she had a choice. No mother. So we should stop blaming. The blame game has to stop. There are people who are looking for children. That's what I used to tell some fathers. If you give some families a child with hemophilia, they will embrace that child because they are looking for children. They've done everything. Thank God that you have a child. Appreciate the child first, and let's put hands together to help the child. In the foundation, we have a group called Red Heart. It's for mothers, women with bleeding disorders, females. It's a safe zone where we can talk. Men, we have a WhatsApp group for Red Heart. We organize once a year physical meetings for women. We teach people's skills. We empower women, courtesy of an organization we're affiliated with in the US. We have set up mothers to do business. We have set up patients to start business. So we have different arms. So if you are a mother, you are not alone.
Can I just say right now, please, can you just make that call and tell them how they can reach out to you?
Yes. So if you are a mother, you can reach out to me. My phone number is 080-3320-6779. 080-3320-6779 is the same number on WhatsApp. Whether a call, a text message, or a WhatsApp, I will connect with you and we will walk this journey together.
Thank you so much. I really appreciate your sharing today. Thank you.
Thank you, Dr. Pamela, for having me. Thank you for all you do, even in educating the public on different health issues. It's really commendable.
Thank you.
Thank you for watching. Please like, share and subscribe for new video updates.